Hi, welcome to my channel. This is Dr. Erica, pharmd. Thank you for joining me on this live topic. Today I'm going to discuss DIFLUCAN, also known as fluconazole, which comes in several different strengths and is indicated for several different fungal infections. Also, more particularly, we may see DIFLUCAN dispensed as a one tablet dosing for vaginal fungal infection. So ladies, you may understand me when I say this, but there's usually a one tablet of 150 milligram that is dispensed for that reason. And it can be taken every 3 days to make sure that the infection is cleared. So there are some precautions to take. There are some details that I want to give in this video, so stay tuned to the end. If you're new to this channel, please subscribe and also like and share as well. So I am Dr. Erica, pharmacist for close to 10 years now, and this is my platform. I also have a website, www.themillenniumpharmacy.com, where you can shop and search for merchandise or what have you, and let me know if there's any items that you don't see that you would like to see, or any topics of discussions that you don't hear but would like for me to go over and research and present here on this platform. Okay, so I'm going to go ahead and get started. So we are talking about DIFLUCAN or fluconazole, which is in the family of the azole family, azole antifungal family. Now this particular one is very special because it covers a lot of different infections, and so it is also very tolerable and not only effective but safe. So that is a plus. We always want medications that are safe and effective based upon FDA and DEA. Okay, so it is indicated for vaginal candidiasis or fungal infection, esophageal infection, systemic infection as well. That means the entire body, like septic or systemic, meaning the blood system that might be contaminated with fungal infections, can be treated with fluconazole. Also, meningitis as well can be treated with this. So do understand that this particular medication not only treats vaginal fungal infections, but also systemic, esophageal, also oral, the pharynx, where the pharynx in the mouth are connected. Any fungal infections that may occur can be treated with this particular medication. It comes in a 50 milligram tablet, 100 milligram tablet, 150 milligram tablet, and a 200 milligram tablet as well. And it's also available as a tablet form or suspension form, I should say, powder, and then also an injection that's used for the for hospitalized patients. Now, this particular medication can cause nausea, headache, taste perversion or change in taste, dizziness, diarrhea, abdominal pain, and also dyspepsia or GERD, uh, acid reflux type symptoms as well. So this medication has an effect on the GI system, as you notice by the side effects that I mentioned. From GERD to diarrhea to nausea, vomiting, abdominal pain, all that is from the GI tract. So it's best to take this medication maybe with a meal or with milk to help offset some of those side effects. Okay, store in a cool and dry place, away from sunlight and away from children, also from pets as well. If a dose is missed, it can be taken as soon as possible. Do not double dosing. So if you're so close to the next dose to be taken, don't take it. Skip that dose and start on your regular, go ahead and continue on with the regular schedule as prescribed. But usually this medication is given out as 150 milligram as a one dose for mainly on the indication of vaginal fungal infection. Now, for mothers who are breastfeeding and taking this medication, it's required that you stop using it while you're breastfeeding because it can be transferred from the mother's milk into the child. So we do not recommend as healthcare providers that this medication be given to those who are breastfeeding. It's okay for pregnant patients. It's category C, which is which means that the mother may receive more benefit and the fetus may receive more benefit from taking the medication versus not taking the medication. Again, that's pregnancy category C. So it's okay to take in those mothers who are expecting. Okay. Also, there may be, in some cases which have been reported, an arrhythmia or a change in the QT interval on the EKG scan. Also, there may be pro-arrhythmic conditions. And also, if lesions begin to progress, or lesions or allergy or anaphylaxis that may occur. Anaphylaxis means an intense allergy reaction from the body to the medication, like swelling of the glands, swelling of the tongue, swelling of the throat, itchy, rashy feelings. Those are anaphylaxis response to the medication. And if any of that occurs, stop taking the medication. There's a contraindication for that. Stop taking the medication, head to the 911 for that particular reason. Now, patients who develop abnormal liver function tests during therapy should be monitored for development of severe hepatic injury. Okay, no evidence of cross hypersensitivity between fluconazole and other azole antifungal agents have been noted. There's no evidence of cross hypersensitivity. So if you're sensitive to fluconazole, you may not be sensitive to another medication in the azole family of medications. Now, there are a list of, I'll go over the drug interactions. I'll just list a few of the drugs that may interact with fluconazole just to be comprehensive in this video. Now, the prothrombin time may increase when taking warfarin or Coumadin with fluconazole. Again, the prothrombin time may be increased. The fluconazole increased plasma levels of phenytoin and midazolam, and also, which is a benzodiazepam, and then also a cyclosporin as well in renal transplant patients. It also increases the plasma concentration and reduces the metabolism of medications for diabetes, and also rifampin enhances the metabolism of concurrently administered fluconazole. So rifampin is also an antibiotic. It's an antibiotic that interacts with this antifungal. So if you're taking rifampin, you're taking phenytoin, or you're taking diabetes medication, do be aware that there may be an increase or decrease in one of the other medications. So do be aware of that. And your pharmacist, when dispensing, they do look out for those particular drug interactions as they review clinically before dispensing the medication. So do be aware of that, those interactions for your own knowledge as well. Okay. Now, this particular medication, DIFLUCAN, it does interact with the cytochrome P450 system in the body, which is a group of protein that actually produces proteins in the body. They determine the metabolism rate and the extension of life of medications. So it's best to, with this particular medication, watch out for other drugs. Watch out for changes in, like, your allergies, changes in your GI tract functioning. Also, be aware of the changes in the heart rate and arrhythmia as well. Okay. Now, this particular medication has a half-life of 30 hours after oral administration. So that's about 1 day and a few hours before another dose is required. But this medication usually, again, is dosed. We mainly see it dosed for as a single dose for fungal infections. So that is all that I have for this particular video. If there's any questions or comments, please leave them. Have a good day.